Hello and welcome. Let's get right into one of the biggest questions for patients here in Pennsylvania. What conditions actually qualify you for a medical marijuana card? If you've been looking for a complete, up-to-date guide, you are in the right place. We're going to make this super simple and clear.
So, is this the exact question you've been asking yourself? Wondering if your specific health challenge is on that official list? Well, this explainer is for you. By the time we're done here, you'll know exactly where you stand and what your options are.
Okay, let's dive in. Before we jump into the list of conditions, it's really helpful to understand the foundation of the program itself. It was all set up by Act 16 way back in 2016, and the Pennsylvania Department of Health is the one that oversees the whole shebang. And here's the magic number: 24. Under that state law, Pennsylvania officially recognizes exactly 24 serious medical conditions. So if you have a confirmed diagnosis for any one of these 24, you've already checked off the first major box to join the program.
You know, when it comes right down to it, the whole process really just boils down to these two things. First, you need that confirmed diagnosis for one of those 24 conditions, and second, you need a certification from a state-registered physician. And it's important to know the doctor doesn't prescribe it, they're simply certifying that you have a qualifying condition. That's what allows you to then register with the state.
All right, now for the part you've been waiting for, the conditions themselves. To make this all easier to follow, we've grouped them into a few logical categories. First up, let's take a look at the conditions that affect the brain and the central nervous system.
As you can see, this is a really big category. It covers such a wide range, everything from seizure disorders like epilepsy to movement disorders like Parkinson's and Tourette's. To really understand the why behind this list, let's put a spotlight on one of these conditions: ALS.
ALS, which you might know as Lou Gehrig's disease, is just a devastating illness where the brain slowly loses its ability to control the body's muscles. For patients and their families, managing the symptoms that come with this progression, well, that becomes the main goal of treatment and care.
And this right here, this shows you exactly why ALS is a qualifying condition. Both research and what patients report suggest that medical cannabis can offer real relief for some of the toughest symptoms. Things like that painful muscle spasticity, chronic pain, and, of course, the profound anxiety that comes with a diagnosis like this. It's really a tool for improving quality of life.
Okay, let's move on and build into our next category. This one covers conditions that are systemic, which means they affect the whole body, or they're autoimmune, which often involves a lot of widespread inflammation.
This group includes a range of really serious diagnoses. Now, for cancer, it's super important to know this also includes remission therapy. So, what does that mean? Well, if you've finished active treatment but you're still dealing with lingering symptoms like pain or nausea, you can still qualify. And for HIV/AIDS, a positive test result is enough. You don't have to wait until the diagnosis has progressed.
Let's use Crohn's disease as our example here. It's a type of inflammatory bowel disease that can be just incredibly difficult to live with. The scientific reason for it being on the list is actually very direct. You see, our bodies have something called an endocannabinoid system that helps regulate how our gut functions and control inflammation, and cannabis interacts directly with that very system.
And now we've made it to our final, and maybe our broadest category. This group includes some of the most commonly certified conditions in the entire Pennsylvania program. It covers experiences related to chronic pain, mental health, and recovery. This set of conditions is just incredibly diverse. It includes mental health diagnoses like anxiety disorder and PTSD, very specific pain conditions like neuropathies, and even complex situations like opioid use disorder, where it's used as a supportive tool in recovery.
Okay, now this is really interesting, so listen close to how severe chronic pain works. As you can see, there are actually two different ways to qualify. On the left, if your pain is neuropathic, which just means it comes from nerve damage, you qualify directly. Simple as that. But look at the path on the right. For pain of any other type, like back pain or fibromyalgia, you can qualify if you can show that other, more conventional treatments just haven't worked for you.
The language for opioid use disorder is very, very specific, and it's important to understand it. Pennsylvania law sees cannabis as a potential tool in two main scenarios. First, if standard treatments aren't working. Or, and this is the most common path, it can be used as an adjunctive therapy. That's just a fancy way of saying it's used to support a patient who is already on a primary treatment, like buprenorphine, not to replace it.
So after hearing all of that, if one of these 24 conditions sounds like what you're going through, you're probably asking, okay, so what do I do now? And the good news is, the process is really straightforward.
probably much more accessible than a lot of people realize. There are really just 4 simple steps. First, you get your certification from a registered doctor, and you can almost always do this online through a quick telehealth appointment. Second, you use that certification to register on the state's official website. Third, if you need a hand, you can register a caregiver to help you out. And finally, you can visit any licensed dispensary in Pennsylvania, talk with a pharmacist, and get your medicine.
I really want to leave you with this powerful thought. This isn't some kind of loophole or a gray area. The law in Pennsylvania explicitly gives patients with these 24 conditions the right to access this form of therapy. And that right exists for you, right now, today.
You know, a lot of times, the only thing standing between you and exploring this option is a simple 15-minute conversation with a doctor. If you've been managing a difficult condition and just not getting the relief you deserve, well, maybe this is the next step in your healthcare journey that's worth taking. Thanks so much for joining me.